What to eat to prevent heart attack? These foods you think low-fat, heart-healthy, or whole grain often hide dangerous ingredients, added sugars, low-quality oils, or refined carbs that spike your blood sugar. And when your blood sugar spikes, it quietly damages your blood vessels. That makes it easier for cholesterol to stick. Your blood gets thicker and pressure builds. And just like that, a heart attack or stroke can hit, triggered by what seemed like an innocent breakfast. Simply changing your daily diet to include the right heart-healthy foods could help you prevent a heart attack or stroke. I've seen it firsthand. Patients who started eating these specific foods daily experienced better health and a calmer, more positive mindset. Today, I'm Dr. Miles, and I'll reveal 10 scientifically backed foods that can naturally cleanse your arteries, helping you prevent heart attacks and strokes before it's too late. Pay close attention to food number 1. It is the most powerful artery repair tool almost unknown in the US, a secret from the longevity cultures of Japan. In reality, many foods marketed as low-fat, heart-healthy, or whole grain often hide dangerous ingredients, added sugars, low-quality oils, or refined carbs that spike your blood sugar. And when your blood sugar spikes, it quietly damages your blood vessels. That makes it easier for cholesterol to stick, your blood gets thicker, and circulation slows down. Pressure builds, and just like that, a heart attack or stroke can hit, triggered by what seemed like an innocent breakfast. I'm not saying this to scare you. I'm saying it to help you understand food doesn't just keep you alive, it can save your life, but only if you choose the right ones. So right now, let's uncover the 10 powerful foods and why they're so good for your heart. Number 10. Garlic, the blood pressure stabilizer. If you're looking for a simple yet powerful way to lower blood pressure and cut cholesterol, garlic absolutely deserves a place in your kitchen. Garlic contains allicin, a potent compound that's released when you crush or chop raw garlic. Allicin helps relax blood vessels, lower bad cholesterol LDL, and naturally stabilize blood pressure. Multiple studies have shown that taking garlic consistently for 8 to 12 weeks can lower total cholesterol by up to 12%. I once had a 70-year-old patient who was afraid to take statins because of the side effects. Instead, he started drinking a mix of crushed raw garlic and warm water every morning. After just 6 weeks, his blood pressure dropped by an average of 7 points, and his cholesterol levels noticeably improved without needing any additional medication. Remember to crush fresh garlic and let it rest for 5 to 10 minutes to fully activate the allicin. Just 1 clove a day, mixed with warm water before breakfast, is enough. Number 9. Fatty fish, the plaque stabilizer. You've probably heard of omega-3, but to get the best heart protective benefits, start with fatty fish like salmon, mackerel, sardines, or herring. These fish are rich in EPA and DHA, 2 essential types of omega-3 that have a direct and powerful effect on reducing inflammation in your body and blood vessels, lowering triglycerides, and slowing the buildup of plaque in your arteries. One study found that eating fatty fish at least twice a week could reduce the risk of dying from heart disease by up to 36%, especially in people over 60. Omega-3s also act as a mild blood thinner, helping prevent blood clots, a common cause of strokes in older adults. I once worked with Mr. Gordon, age 68, who was dealing with mild angina. After eating salmon twice a week and cutting back on fried foods, his cholesterol levels dropped noticeably in just 3 months. Just 2 servings of grilled salmon a week or 1 high-quality omega-3 capsule per day can make a big difference in your heart health after age 50. Number 8. Extra virgin olive oil, the artery polisher. After 50, you don't need to eliminate fat, you just need to choose better fats, and extra virgin olive oil is one of the best choices you can make for your heart. Olive oil is rich in monounsaturated fats MUFAs, which help lower bad cholesterol LDL and raise good cholesterol HDL. HDL acts like a cleanup crew, removing excess cholesterol from artery walls. It's also rich in polyphenols, powerful antioxidants that help reduce inflammation, protect blood vessel walls, and prevent plaque buildup. According to the Predimed study in Spain, using extra virgin olive oil daily can lower your risk of heart attack, stroke, and cardiovascular death by up to 30%. One of my clients, a 63-year-old woman, swapped margarine for olive oil in her salads, and when vegetables. After 4 months, her LDL dropped nearly 20 points. Always choose cold-pressed, extra virgin olive oil with a golden green hue. Just 1 to 2 tablespoons a day, drizzled over salads, steamed veggies, or even mixed into peanut butter for a heart-healthy dip, can help keep your arteries smooth and clear every day. Number 7. Flaxseeds, the dual-action fighter. We all want stable blood pressure, safe cholesterol levels, and to avoid sudden events like stroke or heart attack. Flax seeds are one of the simplest foods to help you start achieving that. Flax seeds are rich in ala, a plant-based omega-3 that helps reduce inflammation, and they are packed with soluble fiber that sweeps out cholesterol. One study published in the journal Hypertension found that consuming 30 grams of flax seeds daily for 6 months reduced systolic blood pressure by 15 millimeters of mercury and diastolic by 7 millimeters of mercury, results comparable to medication but without fatigue or dependency. In addition, flax seeds have been shown to lower LDL cholesterol by 10 to 15%. You don't have to overhaul your entire diet. Just add 1 to 2 tablespoons of ground flax seeds into your breakfast, smoothie, or yogurt. Small steps, done consistently each day, can help you stay healthy and independent for years to come. Number 6. Walnuts, the anti-inflammatory king. If you've been trying to lower your cholesterol and keep your heart healthy, but still aren't seeing results, there's a good chance you haven't added this nut to your diet. Among all nuts, walnuts are the king of anti-inflammatory power. Walnuts are packed with plant-based omega-3s, ALA, and powerful antioxidants like polyphenols. Together, they help significantly reduce bad cholesterol LDL and lower inflammation in your blood vessels, the silent trigger behind most strokes and heart attacks. A study from Harvard University found that eating just 5 servings of walnuts per week could lower your risk of heart disease by up to 25%. I once worked with a patient, Mr. Walter, 67 years old. He had high blood pressure and cholesterol levels always above 240. After switching to a low-carb diet and eating a small handful of walnuts daily, his cholesterol dropped significantly. Always choose raw, unroasted, unsalted walnuts and store them in the fridge. Just one small action a day, swapping out sugary snacks. For a few raw walnuts and you're naturally cleaning your arteries one bite at a time. Number 5. Beets, the natural vascular lubricant. If you've ever struggled with high blood pressure or feel dizzy when standing up, this simple root vegetable might help you in a natural, powerful way. Beets contain a special compound called natural nitrates. When you eat them, your body converts these nitrates into nitric oxide, a molecule that gently relaxes and widens your blood vessels. This improves blood flow, takes pressure off your heart, and helps lower blood pressure naturally. In simple terms, it works like lubrication for your circulatory system. A study published in the journal Hypertension found that drinking just 1 glass of beet juice a day can lower blood pressure by 4 to 5 millimeters of mercury. Almost as much as medication, but with no side effects. I once met a 72-year-old woman who struggled with high blood pressure. She began drinking a glass of beet juice every morning, and within just 10 days, her blood pressure dropped, her sleep improved, and she felt noticeably more alert and energized. Number 4. Citrus fruits, the plaque shield. If you've ever worried about high cholesterol, clogged arteries, or your doctor has warned you about signs of atherosclerosis, don't overlook citrus fruits like oranges, lemons, grapefruits, or tangerines. They're rich in a group of natural compounds called flavonoids, especially hesperidin and naringenin, which help prevent plaque from forming in your artery walls. The less plaque you have, the better your blood flows, and the lower your risk of stroke and heart attack. According to a study from the University of Cambridge, people who ate at least 2 servings of citrus fruits per day had a 20 to 25% lower risk of heart events compared to those who ate less than 1 serving per week. I once spoke with a 65-year-old man in Texas. He began eating a pink grapefruit every morning, cut back on sugar, and walked for 20 minutes each evening. After 6 months, his cholesterol levels improved so much that his doctor told him he could avoid the procedure, as long as he kept up the healthy routine. A key reminder: if you're taking statins or blood pressure medications, you must check with your doctor first, as grapefruit can interfere with how some medications work. Number 3. Leafy green vegetables, the artery calcification fighter. If your doctor has ever told you to eat more greens, this is what you need to know. When your arteries become clogged with cholesterol or calcium, your heart has to work much harder. Leafy green vegetables like spinach and kale are rich in natural nitrates, which your body converts into nitric oxide, relaxing blood vessels and lowering blood pressure. A long-term study in Australia tracked over 50,000 people for 23 years and found that those who ate the most leafy greens had up to a 26% lower risk of developing heart disease. Crucially, greens are packed with vitamin K1, which helps prevent arterial calcification, keeping your blood vessels soft and flexible, so your heart doesn't have to strain with every beat. Let me give you a real example. Jean, age 72, had been taking blood pressure medications for over a decade. After joining a senior nutrition program, she started eating kale or spinach salads every evening. Not long after, her blood pressure stabilized, her doctor began tapering her medications, and she felt more in control of her health. Number 2. Pomegranate, the artery rejuvenator. If you're looking for a natural way to clean your arteries, lower your blood pressure, and prevent stroke and heart attack without adding more medications, then pomegranate juice is a great place to start. Pomegranates contain a powerful compound called Punicalagin, an antioxidant that's 3 times stronger than green tea or red wine. It helps slow down plaque buildup inside your arteries. A study published in the journal Atherosclerosis followed patients with severe atherosclerosis. After just 3 months of drinking 50 milliliters of pomegranate juice daily, plaque in their arteries decreased by up to 30%. That's not just a number on paper. It's a real physical change that helps improve blood flow. Pomegranate juice also boosts levels of nitric oxide, a compound that acts like a switch to naturally relax and widen blood vessels. 1 small glass of unsweetened pomegranate juice every morning could become your heart's daily line of defense. Number 1. Natto, the longevity secret. If you truly want to reverse clogged arteries, there's nothing more powerful than a nutrient called vitamin K2, especially the form found in natto. Natto is a traditional Japanese fermented soybean dish. It has a strong smell and bold taste, but it contains the highest natural amount of vitamin K to MK7. The form that scientifically directs calcium to leave your arteries and go into your bones, right where your body actually needs it. This may sound small, but this is often the difference between someone who has a heart attack at 58 and someone still riding their bike at 85. One study published in the Journal of Nutrition followed over 16,000 Dutch adults over age 44 10 years. Those with the highest K2 intake had a 57% lower risk of dying from heart disease and nearly 50% less arterial calcification. Natto is so effective because it also contains Nattokinase, a natural enzyme shown to dissolve blood clots, reduce blood viscosity, and help prevent strokes before they happen. Just by eating natto 2 to 3 times a week or taking a high-quality K2MK7 supplement, you're giving your heart a powerful tool to protect and heal itself. Final thoughts. The power of consistency. As we pass age 50, the most valuable thing isn't just time. It's the quality of each day we get to live. Healthy, clear-minded, and free from medications or hospital visits. You don't have to change your entire life overnight. Just start with 1 small choice. Add 1 heart-healthy food to your meals and stick with it. That alone can make a huge difference in your heart and artery health. If you've decided what your first step will be, leave a comment saying, "I'm starting with." Because sometimes a public commitment helps you stay consistent, and if this video helped you, please share it with someone you care about, especially anyone over 50. 1 small change today could save a life tomorrow. Don't forget to hit the like button, which helps YouTube share this message with others who need it. And if you want more trustworthy tips for a healthier heart, subscribe to the channel. I'll be right here with you, helping you live stronger, longer, and with more vitality every day.